producer. So thanks everyone so much for joining us tonight. We're so excited to see so many familiar faces, and we are so excited to have our guest with us this evening. We will go ahead and actually just jump on in. I know a few more people will probably join in the next minute or two, but we'll go ahead and get started. But I wanted to introduce to you tonight Ben Fulgencio, I hope I'm pronouncing that correctly, Turner, who leads the Climate for Health program, a national initiative to build climate leadership and action in the health sector, advancing solutions that protect personal and community health. Ben started his career as a community organizer in New Orleans, supporting neighborhood leaders and building power in communities recovering from Hurricane Katrina. He has studied and worked within systems of safety net healthcare in the DC metro area for over 14 years, developing cross-sector partnerships to address root causes of health inequities. He received a BA from Tulane and an MPP from Georgetown University, and we are so excited that he is here to join us tonight. So Ben, I'm going to turn it over to you.
Great. Thank you so much, Sarah. It's good to see everyone this evening. So I have a few slides, but I'm curious before I pull them up, just if how many folks here are familiar with Climate for Health or ecoAmerica or the Ambassador program? A handful. Okay. I'll do a real quick overview of that. I think I'll need permissions or co-host privilege. Okay, there we go. Perfect. Reading my mind. And let me make sure I'm sharing the right screen. 1 second. Apologies. Always fun with Zoom. All right. There we go. I believe I'm sharing the right screen. All right, so I'm going to breeze right through this, but ecoAmerica is a 501c3 organization. We have, like Sarah mentioned, our overall mission is to advance the social movement for climate action. And so we have different programs that do that. We have a faith program, a health program, and a communities program. And they're really built around the idea that engaging these trusted sectors as climate leaders, helping people connect their values, like the value of health with climate action, climate solutions, is what's going to motivate people to push for meaningful action in their day-to-day life, in systems and policy, all the way up. We have a bunch of big national partners that we work with. We work with all these groups on their overall strategy on climate engagement, as well as support and tools for their members that I'll mention a little bit more. And so I know some people have gone through the ambassador training. I always like to, there's so many bad news charts about climate change and health. I'm going to start off with just a couple of my kind of good news charts. So this first one shows that when you ask Americans how concerned they are about climate change, the plurality response, nearly half of people say they are very concerned. But when you ask them how concerned are others around you, that plurality response drops down to the smallest response, whatever the opposite plurality is. About a third as many people say that they think others around them are very concerned as the reality. And there are 75% of people are at least somewhat concerned. And so the reason I call this a good news chart is because the solution to it is really straightforward, that this is a state called pluralistic ignorance, and talking to people about climate change and its impact, sharing your concerns in a productive and structured way, breaks people out of the paralysis of feeling that they are alone, thinking that they're concerned and no one else is, that everyone else is a denier or not thinking about it at all. And the reality is that when you talk about climate change with people, you're much more likely to be pushing on an open door than you think. So I count that as one of my good news charts, both because it's not you're not as alone as you think, and talking about climate change opens up other people to that reality. The second one is health motivates people to take climate action. It is the number one motivator to get people, whether they are wherever they are on the spectrum, whether they're already really active or if they are doing nothing. Connecting it to health motivates them more than anything else. And I'm sure everyone's seen versions of this chart, but health professionals are the most trusted profession in the country. And then I'm adding one more good news chart, which this might be a little bit hard to read. I'll drop the link to this study. It just came out a couple of weeks ago. There we go. Let me pull up the chat. But all right, it's going to do it in a, okay, there we go. So this, I'm sorry, I managed to advance the slide. There we go. So there was a recent survey by the Commonwealth Fund, and they asked hospital employees about their feelings around climate action, the responsibility of their employers. And there was 80% of hospital employees, which we're just going to go ahead and use as a proxy for the general healthcare workforce, want their employer to do more on climate change, on climate action. And something like 60% says it was motivating for where they choose to work. So this is something that I'm including this because it is a very persuasive data set. I urge people to check out that link when you're talking to leadership of institutions to talk about this as a staff engagement, avoiding burnout, avoiding turnover by differentiating yourself by taking climate action can really encourage these health systems through a purely selfish lens to take this more seriously because their staff take it seriously. So a lot of these slides are pulled from our Climate for Health Ambassador training. We use this as a way to engage health professionals, get them connected with tools. I think of this as kind of building the army, of getting people over the hump of saying, this is not my concern. This is too technical, too far outside of my health area, or I don't know how to talk about it without terrifying people or bumming them out. And so this training gets people a grounding in the basics and then best practices for communications so that when you do talk about climate change with people, you can have productive conversations that again try to open doors, get people committed to action, and move them forward. And the other tool I'll come back and talk about a little bit more, I know folks here are very interested, is our ClimateRX badge program. So we launched this about less than a year and a half ago, still pretty new. We've got about 10,000 folks have now engaged with it. We're really excited about this just as a way for health professionals to be visibly engaged on climate and to help people make the climate health connection as a everyday action that does not need to interrupt their care, that can lead to conversations that are super short, that are just these wildfire smokes. Yes, they really do affect your breathing, your other health conditions. I'm going to tell you some instructions if you want to learn more about other climate impacts on your health and how to protect yourself. You can scan this to learn more. So really trying to make this just something that is a very fast and easy way for everyone to start engaging with this, to give them an on-ramp and then an off-ramp so you're not stuck there for 20 minutes. You can always just say, scan here to check it out. If someone really wants to dive in and you don't have time, or if they're want to get into an argument with you and you don't have time, you can just you can lead them off that way. So I'm gonna just go through a couple really quickly, some of the slides from the ambassador training. I know folks have taken it. So like I said, we do cover the health impacts. We aim just to give a quick review of many of the biggest ones. We talk about different ways that you can take action and how your local actions in your home, workplace, community, and in policy then drive towards not just solving climate change, not just mitigating future impacts, but bringing immediate health benefits to your community. We know that is one of the things that motivates people more than just about anything else. If you can talk about how electric school buses mean that kids aren't breathing diesel fumes and what benefits there are to that, that gets people a lot more motivated than the CO2 concentrations in 2100. That we want to help people connect it to their local community, their families, and to these impacts that are right here and right away. And then we do encourage people to kind of engage, not just capital A advocacy. If you're comfortable doing capital A advocacy, we absolutely want it. We want to support people and get them there, but we want to give on-ramps for people to get started, give them scaffolding for there to be conversations with family, friends, and neighbors, and to grow that up. And I saw that several people here already took the ambassador training, and really the core of the communications research and that we did really focused on having this 5-step pathway for having climate health conversations, where we want to connect with people's values on that first step, talk about climate impacts that are happening in the community. Like I said, talk about that there are solutions to those impacts. This isn't just something bad's happening and then another bad thing's happening and other bad things. You start talking about the solutions and that they bring immediate personal benefits. Then you connect it to this is part of a collective impact, that you are part of solving this broader problem, and then end with your ask, you activate. So this is great for framing out structured presentations and speeches, as well as once you kind of have the muscle memory of leaning on this framework, just for conversations at a barbecue or on an airplane, that when someone asks you about, and you end up talking about climate change, that kind of sticking to this framework just helps it from becoming a conversation that spirals into bad faith or spirals into bad news, that you're focused on helping someone take it one step further. Again, I mentioned the ambassador program. We give out resources, including state toolkits. We try to connect people with actions that are happening in their state. We have now, man, I think we're up over 1,700 health ambassadors that have signed a commitment and joined an online community. That's up about triple from where it was 18, 19 months ago. So we're really growing this program fast. And this is something where I am happy if people can reach out to me. I'll have my email at the end of this. If there's something you want to share with that network, if there's an action coming up, or you want me to connect it with just with the folks in Virginia, don't be shy. Shoot me a note. I will put it out there. And then for people taking the ambassador training, it is good for 3 units of CE. It is free. It's online, self-paced. Docs, nurses, PAs, psychologists, social workers, pharmacists, dentists, and dietitians can all get 3 units of CE free for taking this class online. So again, great way to kind of build your army, a nice little hook to get them engaged. And then the only other thing I would just say on ClimateRX, I'm really looking forward to kind of hearing how you all are thinking about engaging with local hospitals on this, how we can support you. We are really open to customizing this to both the physical tools, more printouts, waiting room pamphlets, more support to you if you want to provide these as a lunch and learn, as a kind of lunch and learn brown bag discussion, then you hand out badges or as part of grand rounds. How we can support getting this out to more people. I'm really looking forward to hearing from you. And I just want to emphasize that we are very open to being creative on this, and working with you in a way that, again, gets more people visibly engaging on climate from the health frame as part of their everyday work and everyday role as a health professional. And then lastly here, I just want to leave all of our various contacts. This is the easiest email address I've ever had, just ben@ecoamerica.org. But we have our socials and we have our newsletter. And I'm going to get off of here and get back to people's faces and answer any questions that folks have. And I sprinted through that very fast.
Yeah, Ben, Joel Temmie here. I'm an internist, member of VCCA. This is great. It would be, maybe I can email you, just how would we get, if I wanted to get some pamphlets for our nursing director, for our MEC, executive committee, et cetera, et cetera. That would be nice to be able to have. And could you get, maybe Ryan could email the group out your contact information you flashed up there?
Absolutely. And I'll
I
put in the
didn't write
chat
that.
I'll put in the chat right now too. So it's ben@ecoamerica.org.
Great.
So far for ClimateRX, we haven't developed the pamphlets yet. That is in the queue to kind of put together trifold pamphlets. We know that sometimes wearing a badge, there's personal space. Not everyone wears badges. Sometimes you have so many badges, it's hard to flip out the right one. So we're trying to come up with other ways. We're also going to build out a phone version of the badge, so just an image that you can pull up at any time that has that same QR code branding logo on there. And then the other thing that we've been looking into is, so we have flyers, and then we're looking into kind of other things that can go in the waiting room, like I said, pamphlets or just really quick, trying to keep it simple and positive, not beat people over the head with you're at risk, you're at danger, climate crisis, your health. We want it to be taking action on climate protects your health. Here are things you can do to protect your health and address climate change. So some of that's still being developed right now. What we do have, the badges are free. I can send over a bulk order to you anytime if you know you have some folks that will definitely be wearing them, and then anyone can order them online. We usually get them out within a couple of weeks.
Thank you.
Yeah, so Ben, thank you so much. For one, I've been wearing a ClimateRX badge for almost a year. And I'll be honest, two things. Well, first thing I was worried I would get like a negative reaction to it, and that I have not. Though certainly I think I've worked in places where I was working before at the beginning of this period of time. I strongly suspect actually my medical director isn't in support of policies to combat climate change, I'll put it that way. But never said a single word to me about it. Nobody did. I think the flip side of that is I've had very few conversations sparked by it. And actually, in particular, the ones that have been with a young nurse I work with now and who's asked a couple questions. And I think it's led to a positive conversation. So I think I'll say to people's concern that it might be problematic. I think most people don't notice it. But I guess I'd be interested to hear two things from you, which is first, what do you think is a successful rollout campaign looks like at a facility, or what candidate have you seen it look like? And then number two, I'm curious about the next step. And I think I was telling Sarah earlier, we're seeing a lot of people with respiratory symptoms, and I'm talking about the fact that like warm weather is really early this year. And it's overlapping in a very negative way with like the end of virus season. And I keep thinking about like the next step linkage I could make, but again, in this case, the patients I'm talking to.
Yeah, so
I'm not sure whether they'd be receptive or interested.
yeah, and this is something that I've talked with a lot of people who've been wearing the badge and have pretty similar experiences where pretty rarely do they get any negative reactions. And if they're not using it to start a conversation, it doesn't by itself ping a lot of conversations. And when it does, it's usually with colleagues. That a colleague might come and say, "Oh, what's that about?" And then you have a conversation there. One thing that we've worked on is a set of conversation starters, a very simple sample. Here's how to kind of make the connection in a couple of sentences and then say, and you can scan here to learn more. Hearing from you and from some other people, I think it might also be helpful kind of as framing it less as a conversation starter, but more as kind of an introduction to the badge, that this is something that's happening after you've done your duties, you provide the medical care and the advice, and now you're saying there are a lot of other impacts related to climate change, like this changing weather, like wildfire smoke, like unusual extreme snaps of heat or flooding. And you can learn more about all of these in different ways to protect your health. This isn't the only thing. There are others, and there are a lot of ways to protect your health, and you can learn that. That's kind of what comes to mind in terms of your second question of what that looks like. And again, that's something that I'd love to hear people who are actually out in the field talking to people, talking to colleagues about this, on how that works. Bouncing back to your first question of what a successful rollout in a facility looks like. So I think that so far the most successful rollouts we've had have been with people who are not asking permission, just go out and do it, and get a few colleagues on board, and then if someone's upset, they kind of work with it, but usually they're able to kind of roll it out and have a critical mass of people wearing it. You have good enough visibility and cross through a threshold. And they usually point to the fact that this has been reviewed and endorsed or co-signed by APHA, by American Psychological Association, by Kaiser Permanente, by these big nonpartisan national groups that are not known as being super activist on any of these issues. But I think that I think the ideal rollout does have some institutional buy-in, does have not just clinicians wearing badges at a critical mass, which is really what we want. We want to see lots and lots of people all at one facility wearing the badge, that kind of overwhelming visibility that you see it multiple times. I think that in addition, having signage, having people in the clinic having a conversation about how to have these conversations, how to make it part of the care, whether this leads to more participation in a green team and sustainability units, or more participation with kind of extracurricular stuff on advocacy and engagement with groups like VCCA. So that's the general answer. But I see Leon popped up in hands. Good to see Leon.
You too as well. Thanks, Ben. Yeah, just to jump away from Virginia for a minute. A good friend of mine and colleague, in fact, I'm going to be in his class teaching it in a couple of weeks on climate, is in Connecticut. And he worked with Ben, Mike Pescusilla. He's a health officer in the state of Connecticut. They're different than Virginia. Virginia's centralized public health, and therefore each local health director across the state of Virginia is an employee of Richmond. In Connecticut, you're an employee of the local community, your jurisdiction that you have, your public health agency covers. So that means there's a whole lot of independent in Connecticut. I think there's like 121, something like that, health departments. And as I understand the collaboration, Ben, Mike and you worked it out. He brought in all the health directors across the state. They meet, usually once a month or whatever, because Connecticut's small enough they're able to do that, and conduct their business concerning their focus and mission. But they carved in a whole climate section with education, and then they were all awarded the RX badges, right? Is that how that went down?
Yeah, so I did Mike reached out, and so they were he was planning the first in-person convening of all of the health directors since COVID, and wanted a climate focus. So it was a full day affair, and the first 4 hours was the full Climate for Health Ambassador training. I did it live with them. We pulled in some folks from Yale and some folks who have been running a seashell reclamation unit. I learned a lot about oyster and clam shells to be examples of what this looks like on the ground from a public health perspective. And yeah, I did not realize that Connecticut had over 100 health directors, but they were all in the room. They were all really engaged. It was a really positive meeting. I would be thrilled to do that again, especially somewhere on a train ride from DC. If we can get that kind of audience together again, that is something I would happily do. We do not charge for these kinds of events. I will come if we can get 100 people in a room together that want to sit for 4 hours and take this training, whether they're health directors or clinicians or any kind of role they are. That is something I will drop everything and try to make it work.
Yeah, and by way of an example for the people on the call here, I wanted to share that Connecticut experience. Even though it's on the public health side of the aisle, doesn't mean hospitals and staff can't do that in a collective fashion if they can do it. Even regionally in the state, do the Eastern Seaboard, the Central, and the Western, whatever works. But that might be
the other. Yeah, and the other thing I should have mentioned, I would have, if Janice was here in person, I would have remembered to even include it while I had my slides up. But we've been working with Janice Hawkins for a few years now. She has her Old Dominion nursing students take the ambassador training, engage in really meaningful enrichment activities around it and community engagement activities after taking the ambassador training. She was recently published in Nurse Educator Journal on the findings of her review of it. I mean, she has been great. It inspired us to then work with a professor at Chicago Medical School, Rosalind Franklin University. Now we have the entire first year class of medical students taking the ambassador training. That's not, if anyone here is affiliated with the university, I am more than happy to work with you on using the online version as take this on your own time. I've done guest lectures at several different universities for medical students, public health students, and nursing students who've taken this class. So just as another way to kind of, I'm really thinking about this as just a way to build the army. That ClimateRX is, that we're out there, we're wearing it, we're being visible, but we want to have people with the grounding for it.
Yeah, 2 hours before this call started, I was on the state Virginia Clinicians for Climate Action Education Committee, and that group is sponsoring and coordinating a statewide meeting actually coming up in another month or so. And it's affiliated with a couple of the other med schools that are doing their own thing. In fact, I think at UVA, through the nursing student program, they are sponsoring a heat and climate and health, day of information. So yeah, those entities are there, and what I'm trying to say is there is a system where we have climate education at all those levels: the physician level, physician education, med school level, nursing school level, et cetera. So it's a matter of maybe the sustainability committee's got to be the one that cracked the whip, but that might be something we want to do to kind of engage them at their 2025 meetings to be doing just what we just talked about. Maybe having a 2-hour or more session on climate, and then also do the ClimateRX, as part of the package. Just just FYI. And so I'm thinking out of the box. So, whatever.
So can I ask a clarifying question, which is, do you see the ambassador training, Ben, as something comes before you wear the badge, or are they possibly kind of separate steps in a process?
So they are separate steps that work well together. Is kind of how I think about it, that anyone can get the badge and wear the badge. Anyone can take the training. I think they work really well together because the ambassador training is so focused on effective communication, and then the badge is a reminder and provocation to start having those conversations. And so I think that they work really well together, but you can have one or the other.
Yeah, I'm a little old school. I believe in working for your benefit. So let's train first, and then they're rewarded with the badge as a an emblem of their success and their dedication and commitment.
Yeah, that was exactly my question, Abigail, was, so we have so I'm at the director of sustainability at Carillion. And so we have a couple of events coming up, and one is an Earth Day event that we'll have on Earth Day. And we'll have tabling in all the lobbies of all of our hospitals. And so we're trying to, of course, we're finding vendors and different people to come in and talk about what Carillion is doing. And so I'm thinking it would be logical well, initially I thought, it'll make a lot of sense for me to get some of this from Ben, and then we could give it away. But I want to make sure, but that was my question, was the same as Abigail, was it, am I giving it to them and saying, go ahead and wear it? And then, or like you'd mentioned, maybe you have a script or something for them. So, cause they're going to pick it up and say, well, what do I do with this? And I want to be, that I'm clear that I'm in telling them what they should be doing with it.
Yeah, so we send out with the badges a little card that includes a description of what this is, how it works, and on the back we just have one example of a script of how you could bring up climate change and health in your everyday conversations. We have throughout the website, I think even on that kind of intro 4x6 card, links to the Climate for Health ambassador training. So we do encourage people to come in and get trained. But I think that if someone is interested in climate change and health and wants to start signaling that and having conversations and being a part of it, our goal right now is to build that kind of critical mass of visibility. Maybe we'll get to a point where we'll start restricting and say you gotta earn this badge. But for right now, we want people to be wearing the badge, having the conversation. Maybe they run up into their own limits and then come to take the training and learn more.
And you said there are buttons too, because that's what we'll use at Carillion.
Might have some up here. Yeah, sorry, I'm up in my loft, so it's a little hard to find stuff. Yeah, so yeah, we have buttons too. That I don't think we order one big old mess of those. I can get those too. They're a little bit tougher to ship, but I'm pretty sure I could fill up about. Oh no, wait, yeah, there I have the flat rate postage. Yeah, so I could send you 100 or 150 of those, no problem, in one of those smaller boxes.
Yeah, that would be great.
Just ping me to remind me. I think I'll be in the office tomorrow. I should be able to do it then.
Great.
And I think it's fair to say, I'll say this from the opposite end from Leon, which is to say, and in part, I have a full-time job and 3 kids. And so I did it, I think, thinking I was going to have to do a 4-hour training to start wearing a badge would have been a non-starter. So instead of I think most health professionals who might want to wear a ClimateRX badge know a lot of what you need to know to put it on your badge, right? And to have a basic conversation. Then for me, that kind of made me keep on thinking about doing the ambassador training, and it took me about a year to get around to starting it. Which just reinforced that I knew what I needed to know and actually gave me more useful ways to like communication skills. So I think if you found a person who's nervous about wearing it, that I think that it's useful to encourage the training first. And if you found a person who can, I'm willing to wear a badge, but I'm not going to do 4 hours of training, then I think it's okay to encourage that approach. That's my experience as a lazy person.
Yeah, I'm also a tough grader when it comes to students too. So
Right.
Can you guys hear me? I have a question. This is, my name is Joanne Andrush. I'm a critical care physician and have taken the ambassador training and ordered sort of bulk badges. And I just kind of maybe tagging on to what Abigail was saying, didn't put it on and haven't put it on immediately because I kind of brought it forth to our sustainability and it immediately kind of became, well, does executive leadership know about this? Like, can you just throw this on your, like, I'm a hospital-based physician. And so, do you put this in front of your hospital badge? And then, facilities was like, well, it can't be attached to your badge. That's not allowed. But if you put it on top of your badge, then you can't see your ID that says Dr. Joanne Andrush. And so I hadn't done it yet. And I'm presenting to our executive leadership next week, basically to amongst other sustainability initiatives, but to ask and say, can I move forward with this? Do I have permission to put this badge on? And can I start handing it out to other employees? And I'm just curious if you are finding other physicians in that similar situation, or if it's kind of, do it, instead of asking permission, ask for forgiveness later.
Yeah, so definitely my experience with hospitals is even if they are not politically conservative, they are small c conservative about many, many things. And so asking will typically get a delay at most places at best. And so I know a lot of people just move ahead with it until they're told to stop. And there's not, again, I can't endorse, deliberately breaking the rules or provoking the powers that be. And so if you feel that to maintain the peace, it is necessary to have this conversation, keep them on board, preserve your relationships, I would never want to harm relationships in any way. But if you're in a place where you can ask for forgiveness later, that so far has been an effective strategy. And it can then ask for forgiveness if it does not alienate people, if they do have a problem or want to learn more about it, it can then lead to a conversation about, okay, so what does full implementation of this look like? I think one of the things that we are missing from the ClimateRX campaign is how do I talk to the bosses about this, or the facilities people, or the administration about the badge and about engaging with it. That could definitely, I think that could be something I work on pulling together in the next couple of months, of having some documents, some research, talking points, if you really get formal slides, but at the very least talking points for why this is important and why this tool is not objectionable. Sorry, that's kind of me rambling. Does that answer your question, Joanne?
Yeah, no, it doesn't. I'm very comfortable asking for forgiveness later. And there's, just in bringing it up in our sustainability committee and in my ICU, like there are tons of staff who are interested in it. And I know if I, brought the stack in, I could immediately start handing it out to people. Because when I started telling people that, oh, that's so cool, that's such a great idea. But there were some that were kind of like, do you have permission to do this? Kind of thing. And it made me pause for a second. And I was just curious how common that is being seen
common.
in other institutions.
Yeah, but so from the conversations I've had, it is pretty common that somebody's going to say, did you have permission for this? And if you shrug and keep going, usually can get pretty far before anyone wants to make it an issue. but it varies. You know, there are some places that do want to make it, and if you bring it up, then almost universally you have a delay of several weeks before there's a decision. Again, that's even at places that have a very progressive climate statement, that have said all the right things, that have a sustainability team, that have devoted resources to it. If there's something new and public facing and you ask for permission, often there's a delay to kind of get official buy-in.
And Ben, I think you had said in an earlier conversation when we were talking with Sarah that the pins tend to have a little less of a friction than the ID hanger badge.
Yeah, pins, people wear all kinds of pins, as long as it isn't saying, you know, vote this way, or I hate this kind of person, or this kind of policy, then you can get away with a lot with a pin that doesn't feel as official as a badge. So
yeah, it's not unusual in health systems for there's a lot of rules from a lot of different areas about badges, and that's not just about climate and health. That's just like they don't want you messing with your badge too often. So buttons I think are going to work better for us at Carillion.
Yep. Just ping me. We don't have a official order page on the website for badges, so you just have to, if you email the info@ClimateRX or at my direct email, they both end up in the same spot. So we can get some pins over to you.